Meta, and this is
We're Bob.
And this is Glow Talk. And so today our topic is
weight loss.
So, a lot of people during COVID, all of us actually, just gained like 10, 20 pounds. So we were all baking, doing all sorts of crazy stuff at home, and just were staying at home, honestly, with hardly any physical activity. So all of us had like 20, 30 pounds that we gained.
Yes. So what can we do for trying to lose that weight now?
I know. Really good question. So of course, diet and exercise is there, right? But the new hot topic nowadays is GLP-1s.
What exactly are the options for GLP-1s?
Right. So at this time, we have Wegovy and Zepbound that are approved for weight loss. We do have Ozempic, but Ozempic is for type 2 diabetes. So let me say a little bit of background about
this.
Yes,
please.
So, GLP-1s like Ozempic, they started off as medications for diabetes. Diabetics took them for years. This was originally a diabetes medication. People think these just like came out of nowhere and this is like a new medication. It's not true. It's been given for years to diabetics. What the medical community realized was that when patients were getting GLP-1s, they were losing a lot of weight. These diabetics were losing a lot of weight. Some of them were coming off of the medications. Some of them are being cured of their type 2 diabetes. So that's when a little revolution came about, okay? And they realized that we could give these medications to people that were pre-diabetic or on their way to further chronic illnesses like high blood pressure, high cholesterol, just heart disease in general,
Yeah.
And we realized that if we could bring them back from that cusp, we could actually possibly cure them from that.
Yeah,
and prevent them from getting those diseases.
Yeah.
Since they're already pretty overweight. And as we know, being overweight leads to some of these illnesses.
Yes.
Yeah.
So who are some candidates that should not be are not good candidates for this medication?
It's a very good question because everybody wants to be on it, right? So if you're just trying to lose like 10, 20 pounds and it's only for aesthetic purposes, this is not for you.
Right.
We're looking for somebody whose BMI is kind of up there in that 29, 30 range. Okay. Somebody who really needs this medication. A. B, you have to make sure you're doing the proper types of lab work. There's a complete workup that needs to be happened, assessed and evaluated before we consider this patient a proper candidate for GLP-1s. It cannot be just thrown on people. Okay. And that's also something that needs to be understood. We're not trying to lose 10 pounds for the wedding next month. It's like a proper,
regimen
evaluation that needs to be done. And so if you have any type of pancreatic illness, if you have any type of history of thyroid cancer in your family, any history of reactions to certain medications like this in the past, the medication would not be for you. If there's a patient who's hypoglycemic on a regular basis, you're not going to give them a GLP-1. This is a medication originally for diabetics.
Correct.
So this is not a patient you're going to give it to. So like I said, this is something that needs to be very looked at, titrated, dosed correctly, and it does take a lot of time to do so.
Okay. Yeah. Because lastly, I saw that there's a lot of stuff online being sold. A lot of different compounded things. It's kind of hard to choose like which one,
I laugh because there's just so much political drama around all that.
Yeah.
And in my honest opinion, we should always go with what the FDA says. Okay.
Yeah.
And as of May 2025, the FDA does not allow compounded GLP-1s because that shortage that was there originally is no longer there. So we need to realize that, we would like to go with the official guidelines because those are the rules. That's what's been studied and worked with. And so if you're just getting it delivered from some random pharmacy online, clicking a button and it's coming to your house and you're just dosing yourself, that's actually dangerous.
Yes.
Okay, and that's how people come out with these side effects or just, they end up in the hospital with different things happening to them. It's because a proper physician is not dosing it to them, titrating those doses, making sure the patient's not having side effects, making sure their labs are not being evaluated. None of those things are being done.
Yes.
And so it's a little bit scary. Honestly.
Definitely.
As a physician, that scares me. You know,
100%.
Yeah.
Okay, that sounds good. Well, thank you for the information.
Absolutely.
Yeah.
But we do GLP-1s here at our clinic, and we do a lot before we determine that the patient is ready for it. And there's a huge, process that the patient goes through. And we make sure this is perfect for you, what dosage to start you on. And then once you're started on the dosage, we do titrate you. We do check, follow up with you every month. And we make sure that your labs are being checked quarterly.
Also unwanted side effects. We want to make sure.
We monitor everything. And so that's absolutely something that needs to be done. So if you come to us or wherever you're going, to make sure they're doing all that.
Yes.
All right, we'll see you guys next time.
Yes.
Bye.